Hey everybody, it's Shell here, otherwise known as the Purple Gimp, and I was watching one of Bo from the Fifth Column's latest episodes, and it was all about the value of being a good person, and Bo was looking at it, hi Bo, uh, in the lens, the context of uh, the massive amount of Trump supporters that are on social media all the time, spewing bigotry and hatred and homophobia and transphobia and xenophobia, all the phobias. And in particular, Bo had read about a case of a woman who was giving a baby up for adoption to a very wealthy couple. They friended each other on Facebook, um, and the bio mom found that their personal Facebook, profile and all their posts were 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 full of bigoted hate speech and antithetical to her morals and beliefs as a mom, and she backed out on the adoption. Didn't feel like, in good conscience, that she could give, a baby over to a couple who had such a poor understanding about what's right and decent. And something that Bo said in the video really resonated with me. Uh, he said, "Words are really important. They carry a lot of weight. They adjust the way that people perceive you and what they're willing to do with you and for you." Um, and that really stayed with me, um, especially since over the weekend we crossed the unimaginable threshold um, into over 90,000 lives lost here in America due to coronavirus. 4,688 people have died since Friday, May 15th. Today is Monday, May 18th. So a little bit less than 5,000 people have died here in America in roughly 3 days. Around the world, the death toll is now 320,189. Lives lost from COVID-19, SARS-2 coronavirus. Many of those people um, died alone without the comfort of their families. This virus is so infectious that many hospitals don't allow coronavirus patients to have visitors. Some of you know that I spent Mother's Day this year, in the emergency room being seen. And I had often thought over the last few months about how horrible it was that so many of the coronavirus patients here in America have died alone without their families with them. But it wasn't until the nurse told me that my husband wasn't allowed to go back with me that it really hit me how awful it is to be separated from the ones that you love when you're sick and when you're in pain and when you're scared. Um, not ashamed to admit that I cried like a baby. Totally understand why the hospital was taking extra precautions, but still extremely traumatic and as stressful as it was for me. Um, that has to be a drop in the bucket for what it's like, especially for seriously ill coronavirus patients and their families, to not be able to be together, especially when they're they're drawing their last breaths. Uh, you know, this has gone so far, so fast. I think it's still in there. We're losing um, the impact, the understanding that these are people. These is somebody's grandmother, husband, sister, wife, brother, um, neighbor, uh, school teacher, friend, um, and words matter, and words have effect. And the words from the Trump administration, all these months have been words full of selfishness, bragging about being bigger than The Bachelor and bigger than Monday Night Football. And um, on the morning after we crossed the threshold into 90,000 lives lost here in America, Eric Trump was on Fox News uh, saying that the Democrats were purposely lengthening the shutdown process and the coronavirus pandemic in order to keep his daddy from being able to hold his MAGA rallies, and this was all going to magically disappear after the election. And um, there wasn't any recognition. I got the impression that good old Eric didn't even realize that we had crossed 90,000 dead the night before his interview. Um, and it's ironic that he's doing this interview from the safety of his mansion or little bunker somewhere, and so is the Fox News host. And if this was all a Democratic, pandemic hoax, that the Democrats, got 213 other countries and territories to, willingly infect themselves too, so we could all band together and keep Trump from holding his rallies. You'd think that they would have been together in the same, in closed studio and public space, because this is all a big hoax, right? Um, and it's ironic. Less than 24 hours after Eric Trump was on the news, uh, declaring mitigation measures to try and keep people alive in especially in some of these really hard hit states that just happen to be Democrat led, um, and in states like Michigan, Gretchen Whitmer has done a phenomenal job, as so has Governor Cuomo and Governor Pritzker. Um, they've Governor Murphy of New Jersey. Um, they've dealt with a horrific loss of life in their state, and a tremendous strain on medical resources and critical infrastructure, and the amazing steps that everyone has taken in those states to participate in mitigation measures to slow the infection rate and to slow the death toll, and minimize the amount of lives lost, has been nothing short of heroic. And on a day after Eric declared this all a big Democratic hoax to keep Daddy from having his MAGA rallies, um, Trump casually informed the world that he decided to start taking hydroxychloroquine a couple of weeks ago. Not so coincidentally, right after his Navy valet tested positive for COVID-19. And of course, Trump at the time said that, he had hardly any contact at all um, with this Navy valet, who, from what I understand, was responsible for bringing him his clothes and his food. But either way, uh, Trump just very casually informed the world today that um, he just decided to start taking hydroxychloroquine because he feels like it. Um, he said a lot of good things have come out about the hydroxy. A lot of good things have come out. You'd be surprised at how many people are taking it, especially the frontline workers, before you catch it. I happen to be taking it. I'm taking it, hydroxychloroquine, right now because I think it's good. I've heard a lot of good stories. I'm not going to get hurt by it. It's been around for 40 years. And it's worth noting that the American Medical Association, the American Pharmacists Association, the American Society of Health System Pharmacists all released a joint statement acknowledging that some physicians and others are prophylactically prescribing medications currently identified as potential treatments for COVID-19. We strongly oppose these actions. We caution hospitals, health system, and individual practitioners that no medication has been FDA approved for use in COVID-19 patients. And when journalists were asking Trump for more evidence about the reasons that he's decided just to spontaneously start taking hydroxychloroquine, he says, "Here's my evidence." I get a lot of positive calls about it. Also interesting to note that Trump referenced a nameless doctor in Westchester, New York, that wrote him a letter about taking hydroxychloroquine with erythromycin and zinc, which is interesting because I heard that same nameless Westchester doctor in New York story by several Republican members of the House Energy and Commerce Committee during Dr. Rick Bright's testimony. Dr. Bright, as many of you know, was the former BARDA Federal Vaccine Arm director who was pushed out by Trump after raising concerns about many things, like hydroxychloroquine being one of them. Dr. Bright was alarmed that important vetting steps, safety steps were being skipped, and that Trump was applying a lot of pressure to force them to make large amounts of hydroxychloroquine available to the general public. Over 26 million doses were purchased, some of them from factories in India and Pakistan that were not approved by the FDA, raising the very real concern that a contaminated, a potentially dangerous form of hydroxychloroquine could flood the market. And of course, we all know that Trump started jumping on the hydroxychloroquine bandwagon back in March. At that time, there was minimal anecdotal evidence to suggest that hydroxychloroquine might be beneficial. A really small study out of China and a really small study out of France. Dr. Fauci, Dr. Hahn of the FDA, and experts, all over the country cautioned that, studies needed to be made and looked at before we start passing this stuff out like Tic Tacs. And consequently, The FDA did a study at the VA on male vets that were seriously ill with COVID-19 and found a higher incident rate of mortality, death, especially though in those that had heart problems. And when given in conjunction with the erythromycin, and there have been other preliminary studies already that were enough for the FDA to issue a warning that this drug only be administered in the hospital under the care of a doctor, and in a in a controlled setting like that. The tachycardia risk, the sudden arrhythmia can come on without warning. This is a drug, hydroxychloroquine is a drug that I'm prescribed for rheumatoid arthritis. There's a whole lot of baseline tests that you have to go through before you're even approved for it, and a whole host of nasty side effects, including suicidal ideation, paranoid hallucinations that make you feel like someone's watching you, hair breakage, which I've experienced that already. So this is not a tic tac, and it's extremely reckless and dangerous for someone like Trump, who holds the highest office in our land, who is not a doctor, to directly contradict his own scientific and medical experts. And so you add all of that to the rest of Dr. Bright's testimony in front of the House. And if you haven't seen it, I will link it in the description. Everybody should watch it and make somebody that may be an undecided voter watch it too. It's absolutely shocking. Dr. Bright was trying to raise the alarm as far back as last summer during the Crimson Contagion pandemic drill, that the federal stockpile did not have sufficient PPE, and that in the event of a major biological outbreak here in America, that a critical life-threatening PPE shortage could happen right away. And then continued sounding that alarm as soon as the coronavirus outbreak began in January, and was completely disregarded. He was pressured to, award contracts to Trump cronies and supporters. Warned that there's not only no national testing plan, 4 months now after the coronavirus outbreak began, but there's also no national vaccine plan. There's not enough syringes. There's no plan for which companies would handle production. And the day after Dr. Bright's testimony in front of the House, Trump pops out with his warp speed vaccine plan. The guy that he's tapped to be his vaccine czar has got millions and millions of dollars invested in Moderna stock. And Moderna is leading the pack right now in the vaccine research race. It's not like he wasn't aware that there was a huge conflict of interest before he got that job, but Trump has removed the last, 5 inspector generals. So all the people that would normally do this kind of oversight and background checks and vetting, the kind of people that are going to be trusted with the lives and safety of more than 300 million Americans. Um, there's nobody there making sure that a huge conflict of interest like that don't happen, which is exactly why Trump keeps firing all these IGs, right? So here we have a guy that's from big pharma land, that's already shown that he's got millions and millions of dollars invested in the very company that's being touted as the front runner in the vaccine race. Uh, and sure, he says he's going to, now that he's been caught, he's going to divest some of those stocks. Um, but unfortunately, you add all of these things together, and it sends a real clear message to chronically ill, immunocompromised folks like me that are in the high-risk category, that um, there's no trust, no ability to have faith that any coronavirus vaccine rolled out by the Trump administration is going to be safe for anybody to take, and certainly not for those of us that are in the high risk category.